Morning, everyone. Thank you so much for joining us. Did you know that your body contains more microbial cells than human cells? One of the most prevalent type of microbe in our bodies are bacteria. Bacteria are essential for our body to function as they influence our digestion, mood, skin, and so much more. However, things can start get out of balance if some type of bacteria start to take over the microbiome. This is known as the small intestinal bacterial overgrowth, or SIBO. So up to 36 million people have SIBO, with up to 84% of these people also have symptoms of IBS. This can make understanding if you have SIBO or other conditions and how to treat it very confusing. And this is why we're so glad to chat on IG Live today with Alexa Ress-Sarkadi, the SIBO and gut health coach. During this live, we're going to discuss how to diagnose SIBO, why carbs aren't an enemy, how to prevent SIBO from returning, and so much more. I saw Alexa. Hello. Hi, Alexa.
Hi, can you hear me?
Yes. How are you?
Good. Just give me a second because I cannot hear you for whatever reason. Uh, um, okay, let's try it out. Okay. Maybe we can try again. Or
Yes.
can you hear me?
Yes, I can hear you totally fine.
Okay, now I know. Well, I don't know what happened, but now it works. Sorry. I'm here.
Technical difficulty. It happens all the time. Yeah, at least my Instagram is not updating, because I had a couple times that, once I start and Instagram wants to update, I'm like, uh-oh, okay, it will take at least a few minutes to update.
Yeah, I hope it will work and nothing like that happened.
Yeah, thank you
Otherwise-
so much. I'm good. We're so glad to be chatting this topic today, because we have not covered SIBO before. We talked about microbiome before, but not specifically on SIBO. So, which is pretty awesome. But before we start, tell us a little bit about yourself, like how you became a gut health specialist.
Yeah, so I want to say thank you for inviting me to this conversation. So my name is Alexa Ress-Sarkadi, and I'm a gut health coach and specialize in SIBO and IBM. And basically my journey in this field started with my own health struggles. So I was dealing with acne, bloating, constipation, fatigue, various food intolerances, bloating and whatnot. So I was really frustrated with the symptoms, obviously, and I reached out to conventional medicine to get an answer. And unfortunately, they just could give me like a label, so the IBS label, but I knew it was something more than that. And that's when the investigation started. And basically, later on, I got diagnosed with SIBO. But that was a time when I didn't really feel supported by my doctors. So I got familiar with functional and holistic medicine. And I really like the approach that they had because they try to get to the root cause of the problem and not just masking symptoms. And I really resonated with this approach. And this basically gave me the motivation to learn more and to support other people as well who are struggling as I did. So give them a guidance in this journey because I know that people may feel really alone in this whole journey. So we need all the support that we can get.
So it sounded like your own gut health journey has made you like a better coach for your clients.
I would say, yeah. So definitely my personal experiences with these gut health challenges gave me a deep understanding what it means to live with chronic conditions or symptoms on a daily basis. And I can relate to my client's journey and understanding these ups and downs that comes with this healing journey, definitely.
So on a high level, like what role does gut health play in our overall health?
Yeah, so I think gut health is really like a foundational element of the whole overall health. And when people hear about gut health, they usually think of digestion. So when you eat the food, digest the food, break it down, get the nutrients, and then eliminate the waste. But gut health is much more than that. So it connects to almost every organ in the body, and it manages or controls different functions. So it can manage or control inflammation, metabolism, thyroid health, mental health, skin health, hormonal health, and so on. So it really affects every functions in the body. So a lot of people may not realize that imbalances in the gut can influence how their mental health is, or the anxiety that they may feel, or it can lead to even depression and so many things. So I think it's really like a foundational piece in our whole health, basically.
I gave a brief explanation what SIBO is at the beginning of the live, but can you explain to us, what is SIBO?
Yeah, sure. So SIBO stands for Small Intestinal Bacterial Overgrowth. So as the name suggests, it means there is an over accumulation of bacteria in the small intestine. So normally the small intestine have fewer amount of bacteria compared to the large intestine, where you can find a gut microbiome where trillions of microorganisms live. But the issue starts when these microbes start relocating and get migrated to the small intestine. And the fermentation process starts earlier. So they have now the chance to start fermenting carbohydrates and fibers. And they're creating gas basically, and contribute to various symptoms that are not so comfortable. So they can really create this party in the small intestine, which is not the fun one.
Mm. So you almost answered my next question. My next question is, what are the symptoms of SIBO?
Yeah, so the typical symptoms are bloating. I think that's the most common one, and usually people describe this feeling, what is bloating, like they are 6 months pregnant. So it really gets an extended, they really get this extended belly. And the bloating gets worse by the end of the day, typically. And then it comes with diarrhea and or constipation or alternating bowel movements, nausea, reflux symptoms, abdominal cramps or pain that can also happen, brain fog, um, difficulty with weight management. So some people gain weight, some people have issues losing weight, even without obvious reasons. And it can also contribute to skin problems, so acne, breakouts, eczema, rosacea, and sometimes joint and muscle pain could also happen. And of course, various food intolerances are also typical.
But why do so many people with IBS also have SIBO?
Yeah, it's a good question. So I think it's because it's getting more, I mean, SIBO is getting more recognized in the IBS world as well. So there are different numbers and studies on that, but I would say up to 80% of IBS cases could be caused by SIBO. So that's a huge number, although I would say it also varies. And basically, the symptoms also overlap. So you can see similar symptoms in IBS and SIBO, and even some of the causes could be actually the same behind SIBO and IBS. But I would say maybe the difference is that in IBS, we mostly talk about the gut-brain axis and maybe large intestinal dysbiosis. So when there is an imbalance between the gut and the pathogenic flora, while in SIBO, we can actually measure with a test like the overgrowth of bacteria or other organism in the small intestine. So it's more definable, I would say.
Which which is good because then once you define it, then you can actually figure out a solution.
Which is also tricky, but yes.
Okay, we're gonna get to that. So many people assume that SIBO is food related, but other issues may be involved in its growth. So what else should be considered?
Yeah, so I wouldn't say food is not a factor. So obviously, if somebody is eating a highly inflammatory diet, then sooner or later it can create imbalances that can influence like gut motility, for example. But I would say there are other underlying causes when we talk about SIBO. So mostly poor gut motility, so the way how the food and other substances move through the intestines that could be dysfunctional, uh, like digestive juice production issues. So, for example, not having strong stomach acid or the right pH to prevent any infection or control the bacterial overgrowth or bile production, for example. These are also huge contributing factors. Gut-brain axis issues, so trauma, chronic stress, so being in this fright freeze response all the time. This can basically shut down the whole digestive process. Environmental factors, so like more toxicity, for example, this can completely mess up with the whole digestive process and immune function. And infections from previous food poisoning events, for example, or structural issues. So it's common, and I wouldn't say common, but it can happen in women with endometriosis. That, for example, they had a previous abdominal surgery, and there's a high risk of adhesion formation after that, or even with endometriosis itself, it could happen. So the scar tissue formation that could create kind of like this blockage in the intestines. And obviously, this can also lead to an accumulation of bacteria in some of the places in the intestines. So there are many reasons behind SIBO, and of course, it's important to figure out what might lead the whole overgrowth of bacteria.
So then to diagnose SIBO, I know you must undergo a breath test. So what is it? How does it work?
Yeah, so the most popular test is the SIBO breath test for SIBO that involves measuring, or it can actually measure the different type of gases, so hydrogen, methane, and in the US you can measure hydrogen sulfide as well, which is good news now. And basically, it means that there is a preparation process before doing the test. So the patient has to follow a very strict preparation diet, so a low fermentation diet, and not eating any carbs for 1 or 2 days, which is followed by a 12-hour of overnight fast. And then the patient needs to do like a baseline breath test, for example, to establish basically what the baseline is, and then they need to drink a sugar solution, so it's either lactulose or glucose. So this is a sugar that the bacteria can start fermenting if it's there, and then they need to do like a breath sample every 15 or 20 minutes depending on the lab, and the test takes usually 2 to 3 hours to complete. And basically, if you have an overgrowth of bacteria, then they start fermenting this sugar solution, and they create gases that could be exhaled and captured by the breath test. So this way, basically, you can see whether SIBO is there or not, the amount of overgrowth that someone may have, and the type of overgrowth, so what type of gas you produce. And based on the gas levels, you can decide which treatment option is the best.
Mhm. You mentioned that, breath tests are great tools for SIBO diagnosis, but not the only metrics. So what else should people be aware of?
Yeah, so breath test is great, like a great tool, but the accuracy is not the best, I would say. So it's important that we don't rely solely on the breath test values. and just, let's say, treating the values but not the person itself. So it's important to recognize patient's health history and other conditions if they could be present, and doing more investigation with further testing. So normally in functional medicine, like a comprehensive stool test could be helpful to identify possible contributing factors, but you can't really see if SIBO is there because it's mostly for the large intestine. But there are some bacterial presence or overgrowth that may indicate that there might be SIBO, so methane producers, for example, or Klebsiella, Enterococcus, or E. coli. These are just a few species that could also be present in the small bowel. But yeah, I mean, especially if somebody goes through like a SIBO treatment, it's also important to evaluate how far they have come or what changes they see in the body, not just doing the SIBO retest and being disappointed by the results, why they feel maybe way better than before. So obviously we need to see how the body reacts as well and not just using the test.
So now when it comes to treating SIBO, like what are some things that people tend to do after SIBO diagnosis that they shouldn't do?
Yeah, it's a great question. So I think one of the common mistake is that people think SIBO is an infection, which is not necessarily an infection. I mean, I can't say if it's not coming from an infection, but SIBO itself is not an infection. And the usual protocol is using antibiotics or antimicrobial and eradicate everything that's there basically. And they think that the problem is solved after that. But the issue is there is a reason why there is a high relapse rate. So there were some studies and they measured the relapse rate. So with those who have used rifaximin, so it's a common antibiotic for SIBO, and they did a follow-up at 3 months, 6 months, and 9 months. And what they have found is that at 9 months, around 45% of people relapsed. So if you think about it, almost 30% of the people relapsed at 9 months. So it's a huge number, in my opinion. And I think it also highlights the fact that SIBO is much more than that. And once you can find the underlying reasons or the contributing factors to your SIBO, you can really prevent relapse, basically. So I think it's a huge thing and the misconception that if you just use antibiotics then it's gone. I mean, it certainly can happen. It happened to my friend, and he took it. It was done for him, but I think that's not. Yeah, I think it's not happening for the majority of the people. And the other mistake is that people tend to jump on restrictive diet, which would be okay-ish if it was done short term. But the issue is that they get stuck on these diets long term. And they also have this fear from carbs, especially that it's going to feed everything or getting really serious symptoms. And they start cutting out more and more foods, and they end up having the same type of 5 or 7 foods, and they never come off the diet. So nowadays I see the carnivore diet is also really popular in the SIBO world, but when I ask them if you can come off the diet, that they can't or they haven't even tried.
Oh, wow.
And obviously it has long-term consequences when we talk about the gut microbiome, thyroid health, metabolism. And it also depends on which type of SIBO they have, for example. So for a methane type, which is technically this a methanogen overgrowth, not like SIBO, when we use the terms, I wouldn't say that's the best approach for them to follow a carnivore diet. So yeah, again, yeah, I mean, nutrient deficiencies could also happen, especially if they start reducing the amount of food that they are eating and the variety. And with SIBO, it's also difficult because they already have probably nutrient deficiencies that can make the whole situation worse. So yeah, there are a few things, but I would say these are the two most common mistakes that I see.
Now, when it comes to diet, because you mentioned about carnivore diet and other things, what are some foods that we should eat if we do have SIBO?
Yeah, that's the tricky question because it's so different for everyone. I normally would recommend like a whole food diet and cooked foods at least. So maybe avoiding raw foods at the beginning because they are harder to digest. I mean, there are different types of diets as well for SIBO. So low FODMAP, SCD, biphasic, low fermentation. So if the symptoms are really bad, obviously they can pick one, but they really need maybe a support so they can come off the diet and do a reintroduction process in a strategic way. But just in general, I would recommend protein if they can digest that. So meat, protein, poultry, seafood, fish, or tofu, tempeh, uh, hemp powder for vegetarians, and healthy fats, so avocado oil, olive oil, coconut oil, ghee butter, or even lactose-free butter if they tolerate dairy. And you can also eat still like a lot of like carbs or different carbs or fruits. So berries are really great, citrus fruits as well, carrots, squash, leafy greens, and the more colorful the better so that you can get a benefit for the gut microbes, but you can still eat carbs as well. So many people are okay with quinoa as well or gluten-free grains. So especially like jasmine or basmati rice, these are they have low fermentation points, and they are well tolerated with people who have SIBO. But even other carbs like potatoes, plantains, they could still work. Obviously, you need to see how much you can tolerate. That it doesn't mean that you have to cut out all the carbs or anything. And I mean, other than flowers look great and spices.
So, other than diet, like what other lifestyle habits that could also make SIBO worse that people should be aware of?
Mindless eating habits for one. So like really rushing through the meal or eating on the go or eating while using your phone or eating till late at night. So these are the worst things that you can do. And this can also impair digestion and gut motility, and yet snacking is the other one. So in SIBO, it's important that we give some space for the digestive tract, and the meal spacing is a really great way. So leaving like 3 to 5 hours of gap between meals could be really helpful. But even skipping meals or irregular meal times could mess up with the whole digestive process. And I usually see this with people who have constipation, that their whole daily routine is all over the place. And basically, you need to train back the body to go to the toilet at the same time, ideally in the morning. So routine is really important, and our body loves routine, in my opinion. So it's crucial to do that. I mean, you need to implement some stress management techniques as well because really chronic stress can really reduce digestive juice production, gut motility, and everything. And of course, if you not getting the sleep that you need, then healing process will also be hindered, and even lack of movement or body movement, that's also a problem. So you need to stimulate those muscles and getting those contractions to get the toilet and to reduce bloating.
I felt like whether you have SIBO or not, what you just mentioned, like everyone should be practicing these lifestyle habits anyway.
Additional
Yeah, bunch of
opportunity for any health challenge. So here, yeah, not just for big issues.
yeah. What are some ways that we can prevent SIBO or set up our body so that SIBO doesn't come back?
Yeah, so I partially mentioned some of it. So obviously, if we practice mindful eating habits, then we can control how the food gets digested already. And the meal spacing as well. So the migrating motor complex, which is a type of gut motility that's often dysfunctional in SIBO, it needs that pause, and it can only get activated during basically fasting periods. So if we are snacking all day long, then we can inhibit this function basically. And you can also support this gut motility with supplements or medications, so with prokinetics and ginger artichoke extracts are a few examples, but there are also pharmaceutical ones that could be more or they could be stronger to support gut motility if it's needed. And managing stress as well. So nervous system retraining programs, there are quite a few out there that could be helpful to get out of this constant stress state and calm the body so the healing process can finally start. And even manual therapies, they could be a really great way. So special massage therapies that could resolve adhesion, for example, or issues with the reocycle via function. So there are quite a few manual therapies that could be helpful, and vagus nerve stimulating activities. So to support the gut brain axis, so gargling, gagging, chanting, singing, breath work, cold exposure, or anything, or even there are some devices nowadays that's available where you can directly stimulate the area in the neck or acupressure points in the ear area. So yeah, there are quite a few options there as well.
It feels like a SIBO not only requires a lot of management and also requires tailored approach because each person's symptom can be different and even like different type of SIBO. So
Yeah.
I feel like it makes it working with someone who knows what they're doing really important. So how could people work with you?
Yeah. So if they need more support, or I also have free resources on my website. So if they are newly diagnosed, or if they just want to learn more about, I also have an ultimate SIBO guide, which could be helpful, which mistakes to avoid, for example. But of course, if they would like one-on-one support or even being in a group program, I also have a few options listed on my website, which is seekingguthealth.com, or they can just follow me on Instagram, where they can also learn more about SIBO and some strategies to manage this condition.
Anything else that you're working on you'd like to share?
I'm currently not really working on. I mean, I specifically released a new program, which is the SIBO Free Life Method a few months ago. So this is a step-by-step roadmap and approach to overcome SIBO, and not just about symptom management, but to really get to the root causes, how to do testing, and I also included this whole holistic support or approach for gut healing, so mindset, detoxification, nutrition, exercise, and all of the important areas to support the whole healing process.
That is amazing. Thank you so much for sharing everything with us, Alexa. This is really important. So, and thank you everyone for joining, and be sure to follow Alexa as Seeking Gut Health and book a consultation and check out all the resources on her website. Thank you.
Thank you so much for inviting me. It was a pleasure to talk to you.
Have a good day.
Thank you too. Bye.
Bye.